I'm Nova Elwood. I'm one of the dietitians at Samaritan Albany General Hospital. I work primarily in the hospital with patients who are staying in the hospital there, but I also work at our nutrition clinic. You can't hear me?
Is it on?
Is it on?
There we go. I guess you have to like...
We have a nutrition clinic and outpatient diabetes education clinic there in Albany, and I work there as well. So I see both critically ill patients and generally healthy patients in the clinic there. And this is Rachel Elzinga. She is a dietetic intern from Oregon State University. So she's about 3 months away from sitting for her dietitian exam and becoming a dietitian as well. So I wanted to give her the opportunity to help me with this presentation, and we came up with this presentation together, but I'm going to have her present most of it, but we'll be both available for questions. So please let me know if you can't hear us, if we're not projecting all the way to the back. Go ahead and gesture, and we'll try to talk slowly and clearly. So for nutrition and bone health, we wanted to just remind you all that bones are a living tissue that is continuously remodeling. And so nutrition plays a key role in the health of our bones, particularly as we age. And so the things that we're going to focus on primarily today are calcium, vitamin D, and protein, and the key role that those nutritional elements play in the health of our bones. So Rachel is going to get us started by going over calcium.
So can everyone hear me? I have a really soft voice, so I want to make sure everyone can hear me as I speak. So like Nova said, I'm going to be talking to you guys about calcium. And if I say bone health and nutrition, I'm hoping the first thing that pops into your mind is calcium. And calcium is the most abundant mineral in our body. And over 99% of calcium in our body is found in our bones and in our teeth. And the other 1% is actually found in our blood. Now our blood is really, really covetous over the calcium that it has. And it really wants to make sure that it keeps that calcium in its stream. So if the blood doesn't have enough calcium, it's going to steal from the bones. And as we age, we're actually not putting calcium into our bones, we're actually putting it just into our blood. So dietary calcium is really important so that we can have enough in our bloodstream so that it can be happy and do everything it needs to do. The recommended dietary allowance for calcium for adults is 1,000 milligrams a day. And for seniors or men over the age of 70, women over the age of 50 is 1,200 milligrams a day. And that's because as we age, we lose estrogen and testosterone, which are really essential for for calcium absorption. So that's why we have that increase in RDA. So where can we find our calcium, right, in our foods? How can we get it in our diet? Well, a cup of milk has about 300 milligrams. So if you're looking to have 1,200 milligrams, that would be about 4 cups. If you want sardines with their bones, because I believe you have to eat their bones to get their calcium, you'd want about 3 servings or 4 servings of sardines. If you're not into animal products, you could also go with fortified orange juice, fortified tofu, or even fortified oatmeal. So those are good options as well. And then you see it says 4 ounces of turnip greens right here. Well, how much is 4 ounces? It's about a cup of turnip greens. So if you're looking at that, 99 milligrams in 1 cup of turnip greens, that's 10 to 12 cups, which is kind of a lot. I don't really know a whole lot of people who eat that much turnip greens at once. But the great news about turnip greens and other things like bok choy and cabbage and things like that is that it actually is very bioavailable, meaning our body will absorb it pretty readily. And we'll talk about a little bit how that can be a problem in the next slide. But white beans are also a good source, and those can be good for fortification of your calcium supplements, as well as oranges. So those are some good sources. But we have some words of caution, like I kind of talked about. And the first one is oxalates. So things like spinach and chard and rhubarb and sweet potatoes actually have a bit of calcium in them, but they also have another compound, and that's called oxalates. And oxalates bind to calcium and cause the body to not absorb the calcium. So they're kind of a bad thing. We don't like oxalates, but we really like spinach and chard, so keep eating those. You're just not going to get your calcium from them. And then iron and calcium, they actually are competitors. So plant-based sources of iron is called non-heme, and that competes with calcium. And so if you're taking a calcium or iron supplement, or you're eating a plant-based iron food, don't take it with calcium, otherwise you're going to block the absorption of that really great nutrient as well. So space those out about 4 hours from each other. But that's not the case with animal sources of iron. Animal sources of iron is fine to take in conjunction with calcium sources, so that one's okay. And then large doses of antacids. Large doses of antacids contain a lot of calcium, which is great, but there's two kind of things that can be bad about that. One is that you're getting too much calcium, and Nova will talk a little bit more about why that can be bad. And then the second is that you're not taking it with vitamin D. And we'll talk a little bit more about that as well, because vitamin D actually enhances the absorption of calcium. Oh, just kidding, I'm not done. Okay, so how much should you be getting? Well, like we talked about, 1,000 to 1,200 milligrams of calcium per day. Ideally, we get this from our food. We don't all live in an ideal world, right? Sometimes we don't eat enough calcium-rich foods. So what can you do if that's the case? You can take a calcium supplement, but you want to talk to your doctor or a dietitian about those things. But there's some things you should know about the calcium supplements. One is that a multivitamin actually doesn't contain calcium most of the time. And the reason for that is that calcium's too large. If you were to take a multivitamin that had the multivitamins as well as the calcium, it'd be so big you wouldn't want to eat it. So that's why. So we got to take a separate supplement for that. And then for the supplement, you don't want to take any more than 500 milligrams of calcium at a time, because your body can't absorb more than that at one time. So make sure that when you're looking at a supplement, it's just about 500 per serving. That's usually a good amount. And then, like I said before, vitamin D actually helps with absorption. Do you have a question? So with a multivitamin, they just usually don't have calcium in them, so you have to take it separately. And that's just because the calcium supplement, the mineral calcium is so large that it would be too big for you to take. But they're okay to take. They are great to take together. Yeah, keep taking your multivitamins, just add a calcium supplement if you're low. And now Nova's going to talk a little bit about some controversies with calcium.
So I wanted to address some of these controversies around calcium, because I'm sure if you read the newspaper or watch the news that you've heard of some of these things. They do come up pretty often. And one of those is, can I get enough calcium on a vegan diet? Well, a vegan diet is a diet that has no animal products. So not only no meat or fish or eggs, but also no dairy products. And they've done some studies on people who don't eat any dairy, follow a vegan diet, and the research is really kind of muddy. We don't really have a good idea of why, but a lot of people who don't eat any dairy have just as healthy a bones as some of the people who do eat quite a bit of dairy. And they're trying to get to the bottom of that, but nutrition is very, very hard to research, because you don't eat, foods in isolation. You don't just eat calcium. But what they think is that possibly people who follow a vegan diet may have other aspects of their lifestyle that are also very healthy. Like maybe they're more active, which is kind of skewing those research studies, or maybe they are less likely to smoke. So they're still trying to get to the bottom of that. But if you follow a vegan diet and you eat a lot of those non-dairy sources of calcium that Rachel talked about, then it's quite possible that your bones are still very healthy. But that might be something that you want to explore with a dietitian or your doctor to make sure that you are getting enough calcium. The other thing that's gotten some press lately is prostate cancer risk with large daily intake of calcium. And so I wanted to kind of address this with the bell curve, because what we see with the bell curve is that on one side of the bell curve, which is very low intake of calcium, there are risks. We know there are risks to your bones and there are risks to your health if you don't get enough calcium. But also on the other end, if you get way too much, there are risks as well, with the prostate cancer and also the increased risk of heart disease in women that was discovered. And so that's again why it's important for you to talk to your doctor or dietitian if you're concerned about your heart disease risk or prostate cancer risk, and making sure that if you're taking calcium supplements that you're not getting too much. Okay? Yes?
Roughly how much is too much?
So the upper limit for calcium is 2,000 milligrams a day. And so you can see if you're taking a lot of antacids and possibly a calcium supplement on top of that, that you could be getting close to that upper limit. And that's why it's a good idea, just go through your diet with a dietitian or your doctor, and then just kind of see if it's something that you need. If you're not currently taking a calcium supplement, it's worth that conversation. Yes? So she's asking, she takes 1,000 milligrams of calcium a day, and she's wondering if she could take half of that in the morning and half of that in the evening. And that would actually be what we recommend, because we just say 500 milligrams at a time. More than that, you're not really going to be able to absorb that. And we'll have more time for questions at the end. So I also wanted to talk about vitamin D, which is one of the other elements that's really important to bone health. And really important for being able to absorb your calcium is making sure you get enough vitamin D. And what the research says is if that you have low vitamin D, that your bones are going to be weaker, that you're at higher risk for fractures. And so the best thing that you can do is, if you don't know your vitamin D status, the way that they check that is a blood test from your doctor. And we know that serum levels of vitamin D over 32 nanograms per milliliter, so your doctor will be looking at that. That means you have lower risk of fractures if you can get your vitamin D levels up to that over 32. So your doctor can easily order that blood test to check your serum levels, and then decide if maybe you need a supplement. Vitamin D is found in some foods, but is also made in your skin after sun exposure. And aging reduces your skin's ability to make that vitamin D from the sun. And so that's why it's a particular concern as we age, that we make sure we're getting enough vitamin D. Yes, a question?
Is that supposed to be nanograms or milligrams?
It's 32 nanograms per milliliter. So your doctor can help you kind of decipher what those results mean after they order those for you. So a little bit more controversy around the dose, like what's the recommended dose of vitamin D, and that's why this is really good conversation to have with your doctor, because it is going to be, your recommended dose may change based off of what that lab value shows, whether or not you're very low in vitamin D. But the dietary allowance from the Institute of Medicine is 600 IUs for people 19 to 70, and over 70 is 800 IUs. There are several large health organizations that say that the dose should be higher. And one of those is the Linus Pauling Institute, that's out of Oregon State University. They recommend 2,000 IUs via supplement, especially for adults over 50. So again, it's really important to talk to your doctor about what dose is right for you, and that's going to be based off of what that lab value shows and whether or not you're already starting off kind of low. So vitamin D sources, there aren't really a whole lot of good food sources of vitamin D, so this is kind of part of the problem. So canned salmon is pretty good. That's got the skin of the salmon in it as well as the meat of the salmon. So that's 465 IUs. And then low-fat milk fortified with vitamin D, only 98 IUs per cup. So you can see you'd need quite a bit of even fortified milk just to get to that 2,000 IUs that's recommended by the Linus Pauling Institute. Orange juice fortified with vitamin D is going to be 100 IUs, egg yolks just 37. So 10 to 15 minutes of summer sun exposure in someone under 50, because remember I said if you're over 50, you're not going to make vitamin D as well from the sun. And that's, I believe that stat is 10,000 IUs just from that 10 to 15 minutes of sun exposure. And that's someone with fair skin without sunscreen. So sunscreen does block the UVs that you need to be able to make that vitamin D. So yeah, it's 10,000 to 20,000 IUs for someone with fair skin.
What about fresh or frozen salmon rather than canned?
It's going to be less unless you eat the skin, which some of us do, but it's the vitamin D is in the skin there. So again, not a whole lot of good dietary sources of vitamin D, which is why, especially here in Oregon, which that 45th parallel sign is supposed to animate over my little block there, but we're above the 45th parallel here in Oregon, which means that we can't make vitamin D from the sun at all between the months of October through March, excuse me. So we're just barely starting to make vitamin D again now because we're just too high. So it would actually be a really good time if you've thought about wanting to get your serum vitamin D level checked. Now would be a great time to do that because you've just gone through the time where you probably are getting the least amount from it. Whether or not you've been in your garden or not during our rainy months, you're probably still not making vitamin D from the sun because we're above the 45th parallel. Did I see a question? Yes.
Your doctor give you an injection of vitamin D?
I think that would be a better question to address. She's asking about injectable vitamin D, and I'm going to defer that to your doctor. That's more of something I would rather that you address with them. From a dietitian standpoint, we just like to recommend mainly the oral, and then that takes it up to something that's beyond my scope of practice. Another question?
Fresh mushrooms as being a vitamin D source.
Yes, so some types of mushroom are higher in vitamin D than others, and it kind of depends on the way that they're grown. But there's
Buying at the store, is that a source or not?
yes, the mushrooms that you buy at the store can be a source of vitamin D, and some of them will advertise right on the package that they are higher in vitamin D than a typical mushroom based on the way that they're grown. Yeah, it's still going to be hard to get to that 2,000 IUs that's recommended by the Linus Pauling Institute just from dietary sources, though, even if you're eating a whole lot of mushrooms. Okay, and now I'm going to let Rachel finish us off by talking about protein.
Oh, thanks, Nova. Okay, so now we're going to talk about protein. We've talked about a really important vitamin, vitamin D, and a really important mineral, calcium. And now we're going to talk about a bigger macronutrient, and that's protein. And why are we talking about protein? Well, it's actually the majority of bone is made out of protein, and that's collagen. So collagen is really great in that it gives your bones flexibility. So calcium makes them hard and strong, but protein, that collagen, makes them flexible. So say you're running, you're not going to just break your bones because of the impact of that. You're actually going to have a little bit of flexibility and tension. So a diet high in protein has been found to reduce the occurrence of hip fractures. And protein, like vitamin D, actually helps your body absorb calcium a little bit better. So your protein recommendations, they increase as you age. As you can tell, as we age, absorption just decreases a little bit in a lot of different ways. So how much do you need? You need about 0.5 gram of protein per kilogram, or per pound of body weight, or 1.2 grams per kilogram, but most of us probably don't really think in terms of kilograms, so we're going to go with pounds of body weight. So for example, a 75-year-old man at 175 pounds, he'd need to times his weight by 0.5 grams, and that would give 87.5 grams of protein. Or you can think of it as taking your body weight in pounds and dividing it by 2. Either way, you'll get the same number. And when you look at that number, it's not a hard and fast number. It's not like you're counting out each gram of protein per day, but it gives you a kind of general guideline about how many servings of protein you're looking to get in your diet. And it's going to be increased, like we said. And so where are the sources? A lot of you probably know these. You're going to be looking for meat, and typically a 3-ounce serving of meat, which is about the size of the palm of your hand, or a deck of cards, is going to have about 20 to 30 grams of protein per serving. Whereas some beans and legumes are going to be about more like 8 to 9 or 10 grams per serving. And then nuts and seeds will be about 6 to 7 grams. So both of those are really great sources if you're maybe avoiding animal products. And then milk, what I like about milk is that it has not just calcium, but if it's fortified, it has vitamin D, and then it also has some protein. So it's really good if you're drinking milk. And so those are some other ones. So not everything, unfortunately, is good for the bones, and these are the things that are bad for them. And we're not going to go into extensive detail, but smoking is not good for your bones. Excessive alcohol, and that means more than 1 drink a day for women and more than 2 drinks a day for men. And then large doses of vitamin A supplements. So if you're taking a vitamin A supplement, make sure to look at what the kind is. And we're looking for beta carotene. That's the more benign form of vitamin A, whereas retinol can do a little bit of damage. So kind of look at your supplement for that. And then a sedentary lifestyle, which kind of leads into the next set of slides. And we talked a little bit about this earlier in the previous presentation, and that's physical activity, and that's super important for your bones because bones actually become stronger and they remodel as we do more and more impact and activity. And not only does bone or exercise increase bone strength, but it also increases muscle strength and muscle tone. And if you're increasing your muscle tone, you're also increasing your balance and your coordination, which would mean that you're probably not going to be falling as often and breaking your bones as frequently. So the important thing about physical activity is that you do something you really like to do. Because I don't know about you, but if I sign myself up for something that I don't really want to do, I'm probably not going to keep doing it over and over again. So figure out something that you love to do, preferably something weight-bearing like we talked about earlier, and do that for about 30 minutes a day, 5 days a week if you can. Or if you want to think about it, it's 150 minutes per week. And these are the resources we used in our presentation. We invite you to go and learn more about bone health if you'd like to. And if you have any questions, we can take those now.
Or will be available.
Or will be available after. Sorry about that. Thank you so much.
Let's give them a hand. We'll have some questions afterwards.